Okay, let's unpack this. Have you ever felt, I don't know, just absolutely bombarded by endless health advice? You're not sure who to trust? What truly works for your family? I mean, you're scrolling through videos, group chats, articles, and suddenly yesterday's health truth is today's myth. One person says, eat low fat. Then the next says pork lard is fine. Or maybe your parents swear by 10,000 steps, but then you see a headline saying that exact number actually harms your knees. It's really enough to make your head spin. And you just freeze, right?
Especially when it's about your loved
Oh,
ones.
absolutely. That's the core challenge, isn't it? This information paradox. It's everywhere. So many sources, yet somehow so much confusion, which really brings up a critical question for all of us.
Mm.
How do we possibly cut through all this noise? How do we find health solutions that are actually reliable, actionable for ourselves, for our families? Because you're right, that sheer volume of data, it often just leads to analysis paralysis, not clear action. We end up looking for certainty in this, like sea of conflicting claims. Exactly, analysis paralysis. It's so real. And while that's our mission today, really, we're diving deep into a practical, um, incredibly insightful guide for mastering family health. And this isn't just any guide. The expert who created it, she's not just a professional, she's also a parent navigating kids' health, a child, caring for aging parents, and she's been a patient's family member, making those really tough decisions. So that lived experience, it really grounds the whole approach.
It makes such a difference.
It does. So our mission is to pull out a reliable, truly humanized health management solution, something that equips you to confidently navigate your family's well-being no matter what life throws at you. This isn't just about what to do, but how to do it in a way that fits real life. Making health less of a chore, more a part of your daily joy. We're basically talking about a path to getting what she calls 100 points in family health. So let's face it, this health information jungle, it feels denser than ever. You see top doctors on short videos, right? Links flying around in group chats. Scientific research pushed by accounts you follow. But how do you know? How do you know what's legitimate? How do you tell a real breakthrough from just, I don't know, another fad, especially when the stakes are your family's health?
And this is precisely what the expert behind this guide really grappled with. She saw this same problem not just professionally, but like really profoundly through her personal roles. As a mom, trying to figure out the best thing for her kids. As a daughter, supporting older parents. And as that family member, trying to make good choices for a patient. That personal experience, it's kind of the crucible that forged her whole approach. She gets that people aren't just looking for facts in isolation. You're looking for a coherent system, something trustworthy, that actually works in a busy, complicated life.
Yeah, that personal angle, it just makes it resonate differently. It's not just theory. And what's really remarkable about this guide is how rigorous it is, the methodology. I mean, we're talking about a serious filter here. She meticulously screens research practices from top global medical institutions, leading journals, the WHO, even public health databases, like a decade of work from the China CDC. And her goal, her non-negotiable goal, is to filter out the fluff, the contradictions, find only what's, quote, jointly recognized by most researchers and medical experts and validated in clinical practice. So yeah, we're definitely not talking about fleeting fads.
Right. And this emphasis on rigorously verified info, it directly speaks to that desire you have for knowledge that's thorough, but also quick to grasp. It provides those aha
Oh, yeah.
moments,
Mhm.
by cutting through all the confusion. So the advice you're getting, it isn't just someone's opinion or like one single study that might get contradicted next week. It's the consensus, top medical minds, real-world clinical proof. It's basically about bringing that highest standard of care, but translating it so it's accessible, applicable, empowering your family's health management to really reach that top level.
And crucially, it's a deeply humanized approach. I love this philosophy she shares. She says, health is not about not eating human food. Which, okay, sounds a bit funny at first, but what she means is this isn't about like joyless deprivation, living on bland, sad meals.
Okay, no.
It's about finding practical ways, sustainable ways to stay healthy while actually preserving life's pleasures, making life comfortable, free.
Yes. It fundamentally shifts the whole conversation, doesn't it? Away from that punitive, restrictive mindset towards enjoyment and empowerment. And instead of just focusing on, say, external medical fixes, her decade working with specialists, nutrition, exercise, psychology, sleep doctors, it led her to this really profound belief in the body's own intrinsic self-healing power.
Intrinsic self-healing power. Tell me more about that.
Well, it's that incredible ability, often underestimated, that our bodies have to regulate, repair, and just thrive when we've given the right conditions. She talks about witnessing miracles, literally, in thousands of patients, just by helping them adjust their lifestyle. Simple, consistent changes. So the whole philosophy is grounded in nurturing our body's natural resilience, not just reacting when things go wrong.
Okay, so if health is something you do, practically speaking, where do we start? The guide breaks it down. 5 key modules, starting from the ground up. Module 1 is all about daily small things. Now we're talking really fundamental stuff. How to eat, how to exercise, how to brush your teeth, how to wash your hands. Seems basic, right? Almost too simple. But here's the twist. She argues these foundations are often the most overlooked, yet they hold the key to preventing a huge number of health problems.
Absolutely. This module really highlights how those fundamental everyday actions are so often underestimated. It pushes you to think critically about habits you've had forever, just ingrained things, and shows how tiny adjustments, done consistently, lead to significant long-term benefits. It helps you avoid that trap of chasing some complex, maybe unproven cure, like take brushing your teeth. It's not just about fresh breath, obviously. The guide goes into specific techniques, the timing, which lots of people get wrong, and shows how these little details impact not just your gums, but maybe even systemic inflammation, cardiovascular health.
Wow, okay. Didn't realize brushing technique could be that impactful.
Right. And she notes doing these small things well can avoid a large number of health problems caused by cognitive biases and will surely bring a world of difference in health outcomes.
Hmm.
And by cognitive biases, she just means those automatic thinking patterns like, I've always done it this way, it must be fine, or a quick rinse is good enough.
Hmm.
Those thoughts that kind of nudge us away from what's actually optimal. It's about building that solid, informed foundation.
That makes perfect sense. Okay, so we've got the daily habits covered, building the foundation. But life, well, it isn't always smooth sailing, is it? Curveballs happen. That brings us to Module 2, the Health Emergency Handbook. And this section, I think, is really smart because it acknowledges that perfect health habits, not always possible, especially for busy adults. It tackles those unavoidable situations like staying up late for work, social events you can't skip, long hours at a desk, business travel, staring at screens all day, basically modern life stuff that throws a wrench in our best intentions.
Yeah, it's a really pragmatic acknowledgement of real life, isn't it? It's not demanding perfection. It's about resilience. How do you minimize the damage and bounce back when life pulls you away from the ideal? Which is crucial for actually applying this stuff, because ideal scenarios, they're rare. So this module, it doesn't say never stay up late. That's unrealistic. Instead, it gives specific, actionable strategies to preserve your health to the greatest extent during those times. Like if you have to pull a late night, here are techniques to lessen the metabolic hit, or if you're desk bound, here are micro movements, posture tweaks that really reduce strain. It's about smart damage control, efficient recovery, which is a huge part of any sustainable health plan.
Smart damage control. I like that. Okay, so Module 3. This one's interesting. It tackles those habits that, well, maybe aren't 100% beneficial, but they're deeply ingrained or maybe just really enjoyable. This is the Your Small Habits module. Things like coffee, milk tea, alcohol, snacks, high-intensity exercise. Stuff that, yeah, might not be optimally healthy all the time, but brings pleasure or it's part of our social life. And for people who love them, giving them up completely feels hard. And the guide says you don't have to.
Which raises that important question, right? How do we find the sweet spot between enjoyment and well-being? And this part offers that truly humanized health management solution. It gets that pleasure, moderation, they're vital for a sustainable, healthy lifestyle. It's not pushing for strict, joyless abstinence. For instance, it gives guidance on how to enjoy your daily coffee, or even the occasional milk tea without loading up on sugar or weird additives, or how to pick healthier snacks that actually satisfy cravings without totally derailing you. It's about understanding the impact, making informed adjustments. So you can, as she says, maximize happiness and health simultaneously.
Maximize happiness and health together. Love that. And here's the really exciting part. Just by integrating these first 3 modules, mastering the daily basics, using the emergency handbook, managing small pleasures smartly, your family's health, she says, will have already surpassed most people, reaching 70 points.
70 points, that's significant.
Right. It's a huge achievement. Just by focusing on practical, realistic steps that fit your life. Not some crazy, unsustainable diet or workout plan. Imagine the real difference that makes. Okay, but we've all heard stories, maybe even lived them, of that awful regret. If only I'd known sooner. Like a parent wishing they'd caught something early for their child. Or an adult realizing, maybe too late, that preventable choices led to a major crisis. That painful hindsight, that's what Module 4, the Family Health Full Cycle Maintenance Guide, really aims to prevent. Those moments stick with you, don't they? The missed checkup, the ignored symptom, the late diagnosis for a loved one.
And the expert acknowledges, look, it's not always your fault. She says, It's hard to judge where the health priorities are, where the warning lines are,
Mhm.
especially with a big family, young, old. You don't just automatically know who needs focus or what specific issues might be relevant. So this module, quite brilliantly, organizes major health nodes by age group. For children, youth, middle-aged folks, menopausal individuals, the elderly. And it details exactly what health issues should be focused on at each stage, instead of a proactive blueprint.
A blueprint, yeah. So specific screenings for kids at certain milestones.
Exactly.
Hmm.
Or key dietary things for teenagers. Essential tests for adults heading into middle age. Critical stuff around bone density, hormones during menopause. It's all laid out by age.
Wow. So you can literally just compare yourself, your family members, see which stage everyone's in, and know immediately what key issues need attention. It's like having this personalized roadmap for prevention for everyone in the house. Takes away that awful burden of just not knowing. And she says by managing these critical points, these nodes, combined with the lifestyle stuff from before, your family's health can steadily reach 90 points. Imagine the peace of mind with that level of informed generational preparedness, knowing you're actively steering things towards long-term well-being.
And if you connect that to the bigger picture, this proactive, age-specific approach, it's all about empowerment, empowering you to anticipate, to prevent,
Mhm.
rather than just reacting when a crisis hits. It fundamentally shifts your mindset. From potential regret to informed action, it gives you this comprehensive framework for lifelong well-being across generations, moving beyond just treating symptoms to really understanding the health journey through life, giving the power to step in effectively and early.
Okay, 90 points, that's huge. But
Yeah.
what about those really big, scary health moments when serious issues do come up? The last 10 points, she says, are about how to deal with hospitals. This module gives absolutely crucial guidance for those high-stakes situations, like being in the ER, needing to register for specialist care, making a treatment decision under pressure, having to sign informed consent for surgery, or when a family member ends up in the ICU. These are incredibly high-pressure times, right? Stressful, emotions are running wild.
And this is where health management goes way beyond prevention or daily habits. It's about equipping individuals with the knowledge to make critical decisions under immense pressure. Because those situations, they don't give you much time to think. Often decisions get made in panic. And those decisions profoundly affect family members' lives and quality of life. It's serious stuff. So the expert, she uses her professional knowledge, yes, but also her invaluable personal experience as a patient's family member. Okay. To deconstruct these problems, analyze and weigh options so your decisions will be clear and calm. She offers really practical advice. How to understand the medical jargon, what questions to ask, how to advocate for your loved ones, how to navigate that complex hospital system, basically transforming potential chaos into clarity right when you need it most.
Transforming chaos into clarity. That's powerful. So bringing it all together, what does this mean for you, the listener? This deep dive into family health management, it isn't just about collecting facts, not at all. It's about giving you a robust, reliable, and really human-centered framework to achieve that 100 points in family health. We've kind of journeyed from sifting through all that overwhelming information to mastering daily habits, navigating life's bumps, enjoying pleasures responsibly, proactively managing health across lifespans, and then confidently handling those critical medical moments.
And it raises an important question for all of us, doesn't it? In a life that's filled with so many uncertainties, what aspects are actually within our control? The expert, drawing from years in medicine, seeing countless family stories play out, she shares this really profound reflection. She says, wealth is unpredictable, but happiness can be calculated. Destiny is unpredictable, but family harmony can be calculated. Life and death are unpredictable, but health can be calculated. And that philosophy, it really encourages us to invest our energy wisely. Focus on these calculable parts of life, starting with health. Build that foundation for harmony, for lasting happiness.
Yeah, the calculable things. Her message is so clear and honestly incredibly empowering. She says, life comes to the second half. I'm willing to use this course to help you put a good effort into these calculable things. So for you, for your family, it's about making conscious choices, informed choices, for health, for harmony, for happiness, starting today. Because as she reminds us, it's genuinely never too late to start. So after exploring all these 5 powerful modules with us, what resonated most with you in today's deep dive? And maybe, just maybe, what's one small calculable step you can take today to move your family just a little bit closer to that 100 points in health?